Welcome to News West 9's West Texas View with Johnny Lou Avery.
Welcome to the West Texas View. I'm Johnny Lou Avery, and it's a real pleasure to continue our series of programs about the military and our veterans in America. And today and next Sunday, we're going to be talking to two people about the VA healthcare system and focusing on the Big Spring facility that serves a 54-county catchment area, including several satellite offices and medical facilities that they operate from the Big Spring facility. Joining me today is Daniel Marsh, who is the director of the West Texas VA healthcare systems in Big Spring, and Laurie Phillips, who is the chief of nutrition and food service, but she's also acting public affairs director during an absence of the regular public affairs officer. They're going to talk to us about all of the things we need to know about the VA healthcare system and how it fits into the whole gigantic scheme across the nation. And I am very pleased to welcome Daniel and Laurie, and am excited to hear all of the things that we need to know about this. And before we start, I want you to give me a little bit about your background and how you came to be at the Big Spring facility. Let's start with you, Daniel.
Okay, thank you, Johnny Lou. I started out, I was born in Muskogee, Oklahoma, so I'm not too far from West Texas. I went to college in Northeastern State University after I got out of the Air Force. I served in the Air Force during Vietnam. And so I went back to my hometown to go to college in Tahlequah, which is just a few miles away. I got my Bachelor of Science degree in accounting from Tahlequah, and then joined the VA, and we went to Little Rock. My wife and daughter have moved around with us all over the country in different VA assignments. And after I went to Little Rock, I spent a year there in training in the financial management area of VA, and particularly in Veterans Health Administration. We went up then from Little Rock up to Madison, Wisconsin. We spent some time there. Went back down south to Atlanta, Georgia. From Atlanta, we went over to Houston. We spent a year in Houston. Then we went to Lexington, Kentucky, where I was the chief financial officer. Then went to St. Louis, Missouri. I was a regional financial manager then for an area that encompassed all the way from Marion, Illinois, as far west as Denver, and up through Montana and Wyoming. And we enjoyed that. I got into what we call the Associate Director's Training Program. And once I finished that, I went to Omaha, Nebraska first. And then I went to Columbia, Missouri as the Associate Director. And then I was fortunate enough to be selected for the Director's position in Hot Springs, South Dakota. I was in Hot Springs for about a year, and they asked me to come up to our central office in Washington, D.C. I implemented a program called Decision Support Systems, which ties all of our financial information and all of our clinical information together and gives us a very robust cost accounting system, helps us identify our cost per patient, and all sorts of managerial things like that. That helped the VHA establish the Chief Information Officer position, and we hired a Chief Information Officer, and I went to work for him as part of that organization. And that evolved into us implementing the computerized patient record system, which is our electronic health record system, which is known throughout the world. And that evolved into other IT implementations across our VHA system for healthcare, including our barcode medication administration program and a whole host of other electronic programs that are still going on today and are being carried out by our new CIO position up in VA. Once this position in West Texas came open, I was very interested in it. I applied for it and was interviewed along with other candidates and was fortunate enough to be picked. And I've been here since November of 2008. I have enjoyed every minute of it. It has exceeded my expectations. We have a great group of folks working throughout the West Texas VA healthcare system. We enjoy the whole area of West Texas, and we're just having a great time. And we certainly are glad to be here to talk about taking care of veterans.
Well, to sum up, you've been really in every corner of this country serving in the VA. And so you've been with the VA a total number of how many years?
Since 1971.
So that is a long career, a long and fruitful career. And the other thing that I want us to follow up later and talk about is this system, these two systems that you implemented are now being copied by, or have been copied by the private hospitals. And so it's a lot like NASA develops things for the space program, and then they become a mainstay in our regular living across the nation. And so you have really been at the forefront in modernizing healthcare management, whether it's in the financial end or the patient end.
Yes.
And so that's really interesting. And tracking cost and tracking patients and making sure patients get the right medication and all of those kinds of things with the barcodes on the bracelets.
It's really helped us not only modernize the system, but it's also helped us improve the quality by significant leaps and bounds, and to ensure that our providers, our nurses, have the best possible tools to give our patients the best possible care.
Yeah. Well, I want us to go into that a little bit further, but Laurie, I want us to get to know you a little bit now, because you're in a position as Chief of Nutrition and Food Service that is just one of the most important parts of a hospital.
Yes. Well, I'm not quite the traveler that Mr. Marsh is. I'm a native West Texan. I was actually born and raised in Big Spring, and went to college at Texas Tech in Lubbock. And after I graduated from Tech, then I moved to Dallas, and I did an internship at Baylor Medical Center there and lived in Dallas for about a year. Before I returned back to Big Spring, I married a boy from Big Spring who had a job there. He teaches and coaches in the community, and so it just turned out that we came back to Big Spring, and I worked in the private facility there at Big Spring for a little over 5 years before I transitioned over to the VA in 2001.
And isn't it wonderful to have opportunities in your hometown?
Oh, absolutely.
That fit your training and your job base.
Absolutely.
And I think that's one of the great things about Big Spring has really, well, in our whole Permian Basin area, has not been hit as hard with the job reductions as some communities have. And so that's really a blessing. But and I know that food service is a really hard job, because you've got so many different things to consider, but and I want us to talk about that a little later too. Sure. But let's get back, Daniel, to the history of the VA system, and also how this specific facility fits in.
Okay. The Big Spring VA was opened in 1950. In fact, our 60th anniversary is coming up on July the 16th, and we're preparing a program for that. Our first patient was admitted on July the 16th, 1950. At that particular point in time, we offered a full range of services, including not only medical service but also surgical service. We had a strong mental health component. Of course, at that time, the way the VA was structured, every campus was almost an island unto itself. We didn't have any outpatient clinics. We simply had our main facility there in Big Spring. So veterans, for example, that lived in Midland or Odessa or in our other catchment area pieces had to actually drive to Big Spring for everything.
And that was an inconvenience. We're going to have to take a break now. We're going to come back and catch up on what we started this conversation. See you in just a minute.
Stay tuned. West Texas View will be right back.